Welcome to tonight. On behalf of the Australia-India Institute, I'd like to welcome you to Melbourne University and a talk on integrative holistic sciences, India's holistic sciences, and how best that it can be integrated with modern medicine. So, firstly, I'd like to introduce our esteemed panellists. We have a wonderful panel tonight, starting from the right-hand side, Dr. Craig Hassett, who's Senior Lecturer at the Department of General Practice and Coordinator of Mindfulness Programs at Monash University. Craig is very well known in medical circles, has spoken nationally, internationally, is an acclaimed author. I was very privileged to have Craig as one of my teachers and mentors in university going through Monash University, and it's very nice to be on the same panel as Craig today. Seated next to Craig is Dr. Tim Carr, who's joined us from Sydney this evening. He's come down. Dr. Tim Carr is a general practitioner specialising in Ayurvedic medicine, and Tim is going to talk to us about Ayurvedic medicine and its application in an integrative approach. If I go through all the accolades of all the panellists, I'll be speaking for an hour and a half, so I'm going to be very brief here. And sitting next to Tim is Lee Blaschke, who's President of Yoga Australia, developed Australia's first government-accredited yoga teaching program, the Advanced Diploma of Yoga Teaching. He has over 35 years' experience as a yoga teacher and 22 years as a yoga therapist. So welcome, Lee. And Gautamji, who has just entered. Gautamji represents the Chinmaya Association, is going to talk to us about Vedanta, the Indian spiritual philosophy, and how it applies to health and wellness, and how it can also be integrated into modern medicine. It's wonderful to have you all here tonight. I can see many familiar faces, some new faces, some old faces. And we're going to have a very interactive discussion tonight. Welcome questions at any time. I'm going to do a brief introduction, and then I'm going to hand over to the panellists, and we're going to talk about different topics, starting off with prevention and then moving into more diseases and conditions. So there's three broad areas that we're going to cover tonight. So firstly, every science has its place. Secondly, the integration of the various sciences. And thirdly, ultimately, we just want medicine, whether it's complementary medicine or modern medicine. We just want medicine that works. So I'm going to start off with a short story, and this is when I was a young child in India on a holiday, and as some of us from the Indian subcontinent will remember, a lot of the children get little white patches on their faces, and it can be very difficult to get rid of. And usually it's some kind of a fungal infection or something like that. And so I had been off to see multiple different doctors in India, and nothing was making it go away. Till one fine evening, and I think my mother's here tonight, my uncle's mother went to a tree and pulled off a berry, a fruit, and cut it in half and applied it to my face, and within a few days that little white patch had completely disappeared. So, you know, the Indian holistic science of Ayurveda, of yoga, meditation, is very ancient. It's been there for thousands of years. And the key with any science is applying it at the right time. The way that I sort of came into this field, and you might wonder why is a urologist standing here talking about integrative sciences. When I was going through Monash Medical School, Craig was one of my lecturers. One of our very close friends started complaining of some pain in the bone of his fibula, the fibula bone. And at that time, I think we were studying pathology and we were studying some of the cancers of the bone. And just jokingly, we've said, look, it's probably just an osteosarcoma, a very aggressive bone cancer. And in the end, it turned out to be an osteosarcoma. It was biopsied, diagnosed, and then he went off to have various treatments. The treatments were very aggressive, included surgery for an amputation, and that was followed up with chemotherapy. And every evening, I used to wander back to his house after university and visit him and see how he was going. And usually, he had the bucket next to him. He was vomiting and he was extremely sick. Well, thankfully, 20 years down the track, he's still alive and well with us. But during that period in his life and during our medical school, a friend of mine, I'll use the name Michael, told me that one of the reasons he's able to get through this is through the art of meditation. And I didn't know anything about meditation at that point in time. I think I had been along to one talk by Swami Chinmayananda when I was about 10 or 12 years old. But Marty said that he used meditation and imagery and visualization to help him through the chemotherapy. So that was one of my first exposures to an integrative approach. So every science has its place. Just to use another story, Recently I had a patient come into the hospital, to the Epworth Hospital Emergency Department with blood in his urine, had a CT scan, and he clearly had a kidney cancer on the CT scan. And he is a meditation practitioner, and he refused to believe that this was a kidney cancer. He said, look, I know in my meditations that this is an infection, it's not a cancer. And he decided, I'm going to cure this lump with meditation. So he's gone away and he's been meditating on it. Unfortunately, it hasn't changed in size at all. And he's now gone and had a biopsy, and it's proven to be a cancer. So look, every science has its place. There's a role for meditation, there's a role for surgery, there's a role for Ayurveda. Now, just because these ancient sciences have been around for thousands of years doesn't mean that they're all correct. There can be a lot of myths, there can be a lot of superstitions that go along with it as well. And so just because they're old, it doesn't mean that we accept them blindly. They still have to come under the scrutiny of modern medicine. They still have to come under the scrutiny of modern scientific parameters. So these things are occurring in various parts of the world. In India, some of the yoga universities such as Prashanthi in Bangalore, the Kaivalya Dharma, a close friend, Dr. Ananda in Pondicherry, is doing some wonderful research. The Maharishi University, and Tim will talk about that. They're all doing research, but it's taking time, and it'll take a lot more time before it starts being accepted more. However, we're lagging a little bit behind in Australia. If we compare ourselves to America, hospitals such as the Mayo, Johns Hopkins, Harvard, they all have integrative medicine departments. They're all studying complementary therapies, whether it's Ayurveda or meditation or nutritional supplementation. So we have a long way to go in that respect. In terms of integration, I think the public have voted with their feet. It's now time to start breaking down the barriers. And the barriers and the compartments that I've seen in my 20 years as a doctor, as someone who's been interested in complementary therapies, is you have the medicos who are in their compartment, who are very sceptical and refuse to believe that anything outside of their medical paradigm. You also have the naturopaths, the natural therapists, and I know when my wife was going through a naturopathy training, she used to tell me stories about students who are so anti-doctor and so anti-medicine. And then people who are on a yogic and spiritual path can often be very blinkered as well. So it's now very much time to start breaking down those barriers so that doctors become more open to natural therapies, natural therapists become more open to conventional medicine, yoga practitioners become more open to other things as well. Now, all of you, I'm sure many of you would have tried yoga and meditation, and as I said, the public have voted with their feet. People go to a yoga class or they try mindfulness and they feel the benefit. They don't necessarily need a randomised, double-blind, placebo-controlled trial to prove that. The first aim of any medical science is prevention, and India's holistic sciences with yoga, with meditation, with Ayurveda has a wonderful role to fill in terms of prevention. But in my opinion, the role has to shift further from prevention and preventative medicine into promoting a path of wellness. So it's very easy in general practice setting to say things like avoid smoking, to moderate alcohol, to start doing exercise and to reduce obesity. But taking that one step further into actually promoting a wellness model where people start to achieve greater senses of energy and vitality, that, in my opinion, is the next step. Ultimately, at the end of the day, we just want medicine. It doesn't matter whether it's Eastern medicine, Western medicine, Indian medicine or African medicine. We simply want medicine that works. Let's not be naive about disease. Disease happens for all kinds of reasons. We can take the very best care of our health, have a good diet, can exercise, but sometimes these things are just sporadic and happen out of the blue. And I see it every day in my clinical practice. People who've lived a good life, lived a healthy life, who are struck down with a kidney cancer or bladder cancer, never smoked in their lives, never had chemical exposure to any of these agents, and develop a bladder cancer. So tonight we would like to discuss and explore how we can make use of an ancient culture that has a rich repository of health knowledge. So I'm going to turn over to the panel now, and the format of our discussion is going to be quite interactive and free-flowing. Some of us are meeting for the first time tonight. We haven't discussed anything really. But we're going to start off with prevention and talk about prevention and health promotion for a little while before starting to move on to disease states. So we might start on the right-hand side with Craig. who's been so involved and pioneered meditation and mindfulness in the days when years ago integrative doctors faced a very hostile environment. Craig was at the front line. You can see that he's come through alive and well, thankfully. And so, Craig, I'd just like if you can tell us a little bit about meditation, some of the evidence for meditation and mindfulness, and how this can be integrated into clinical practice.
Yes, when I was a medical student studying a few hundred yards from here, there wasn't a lot on meditation back in the 70s. There was little bits and pieces around about the relaxation response. Herbert, all right. There were bits and pieces around the relaxation response, so that the blood pressure drops, or that there's a relaxation of muscle tension, effects on adrenaline and cortisol and so on. And all of that was very interesting, and it was pretty much the opposite of the stress response. But that was really only a first step. And things sort of chugged along for a while, but in more recent times, as the science of mind-body medicine more generally opened up, and psychoneuroimmunology, and all of these related sciences, then there are a lot more avenues to study a much deeper effect of meditation. So not just its effect on some isolated biochemical or physiological endpoint, but actually what's the effect on a particular condition. And then with the neurosciences, what's the effect on the brain? What's the effect on immunity? Now, what's the effect on genetics? And in all of these kinds of areas, when the studies started to come through, probably the single biggest catalyst for the explosion of interest in meditation research in the last 10, 15 years has been the research that's come out in the early 2000s looking at the impact on conditions like depression. Because as you may or may not be aware, depression's in the process of overtaking heart disease. It's the developed world's #1 burden of disease. And if the trends over the last 50, 60 years continue for another 10, 15, it's going to be way out in front as the developed world's #1 burden of disease. And antidepressants are not turning that Titanic around at all. In fact, they're hardly even putting on the brakes. And when the research came out, using what the wisdom traditions had to say about the mind, about awareness, about the relationships to thought, non-attachment, being in the present moment. All of these kinds of philosophical principles, if you like, were applied to management approaches for depression, and finding, well, people actually take on board these approaches, and mindfulness-based cognitive therapy, for example, the chance of relapsing in depression was just absolutely plummeted compared to treatment as usual. But that was a real catalyst for accelerating the interest in, say, the brain sciences. And mind you, I should say that meditation-based approaches have been used for a range of other mental health problems as well. So anxiety, and there's interesting new work on autism and a whole range of other things, substance abuse, etc. Then the brain sciences. So the research is very clearly showing that meditation changes the structure and the function of the brain. Now, it's been known for a long time with the early EEG changes that gave a rough idea there's something interesting going on in the brain, but now literally thickens the grey matter, stimulates neurogenesis. That's the stimulation of new brain cell growth in the adult brain. The adult brain was not meant to be able to do that. The medical dogma was for about 100 years the adult brain doesn't make new brain cells. We now know that's not true. And meditation, particularly in the areas of the brain that get damaged by stress, memory centres, executive functioning areas, meditation adds on new brain cells, improves the functioning of those areas, quietens down the stress centre, the amygdala, and so on. So there's all of the brain sciences. The therapeutic effects, managing severe chronic pain, effects on immunity and reduced days off with sick leave, for example, with respiratory infections, facilitating healthy lifestyle change. So there's a whole range of therapeutic applications that are now being used either as a single treatment or as adjuncts to other treatments as well. Now there's a lot of interesting work with leadership development, so mindfulness seems to be very important in helping to develop the qualities associated with good leadership. Empathy and communication, research on health practitioners. A lot of this is published in the world's leading journals. Journal of the American Medical Association, mindfulness training, for example, having an effect of improving empathy and reducing burnout, improving mental health and clinical performance, communication patterns in, say, physicians. So there's that whole area as well. and improve cognitive function, which is, executive functions. And some of the most interesting work now is going on in genetics. And an Australian Nobel Prize winner by the name of Elizabeth Blackburn, and some of the work that her and her lab have been doing, showing that mindfulness and meditation training, including yogic forms of meditation as well, stimulate the repair enzymes in the nucleus of the cell and slowing down the rate of aging on the level of the DNA. Other studies on meditation, when looking at the genetic levers and switches that control immunity, it's actually changing the genetic levers and switches away from inflammation and towards positive immunity. It's actually having effects on levels that couldn't have even been conceived of when it was just, oh, it's physical relaxation, oh, it's just dropping a little bit of the adrenaline and so on. It's gone way past that. And and heaven only knows where it's going to go next. So it's actually the endpoints of treating these kinds of conditions, not just making a change, but actually those kinds of endpoints that are really creating a huge amount of fascination.
So not just in prevention, but in many disease states, meditation has a role proven and some that are yet to be proven.
Yeah, I think too, one of the interesting areas as well, I think the mind is the most crucial thing in health. Because if we don't get the mind right, we don't get anything else right. And I don't just mean that because the mind has direct effects on our immunity and on our genetics and on our physiology and on our metabolism and so on. I also mean that because the mind is what decides what we put in our mouth in terms of what we eat, whether or not we exercise, and what we put into the environment. So for me, what's going on the planet is also a mind-body interaction. And an unconscious mind, an undiscerning approach to life, and we destroy the environment as well as our own health. So the mind's the most crucial thing. If we get that right, it makes a lot of other things possible. And the most important thing, I think, in helping to develop that capacity is through meditation. That's the most single useful thing that we can do.
So just staying with the trail of prevention and meditation, wondering if we can hand over to Tim. And Tim is also an accredited trained transcendental meditation teacher. So as many of you will know, transcendental meditation, swept the world with Maharishi Mahesh Yogi and became famous with the Beatles practicing meditation as well. So Tim, wondering if you can say a little bit about transcendental meditation and then move into Ayurveda and the Ayurvedic approach to prevention. Firstly, how many of you know about Ayurveda? Everyone knows about Ayurveda these days. So Tim, just over to you to talk about transcendental meditation and then moving into Ayurvedic approach to prevention.
Yeah, thanks, Roger. Yeah, so from the Ayurvedic point of view, health is a natural phenomenon. To be healthy is just a natural phenomenon that doesn't require any input from us, apart from not interfering with what's natural. The whole process of becoming healthy from an Ayurvedic point of view doesn't require much more than, as Craig mentioned, becoming more connected with who we are, with ourself. The term for health in Ayurveda is swastha. Swa means self, star established. So being healthy is just simply a matter of being established in who we are, in ourself. Being unhealthy is a result of being disconnected from ourself. So the self is the source of everything. And that's why meditation is such a key to all the health sciences, as Craig pointed out. With regard to transcendental meditation, I guess, differs from other meditations in that in transcendental meditation, the mind is allowed to effortlessly transcend the actual process of meditation. And the mind naturally experiences a state of being where the mind expands beyond time and space and experiences this experience of inner silence, of wakefulness. It doesn't require any attempt to control or to bring about any particular effect. So with Vipassana or the Zen techniques, there's an attempt to maybe create compassion or loving kindness, some cognitive skill like that, which is associated with some development of the cortex associated with that. It doesn't involve the actual process of observing thoughts and experiences that come in and out of the awareness, as does mindfulness. It's simply a tool to allow the mind to transcend all sensory input, all thought, and simply be. And that state of being, from the Ayurvedic point of view, is the start of it all. From consciousness comes matter, and this is something that's not too out of step with what modern physics is telling us. Max Planck, who's the grandfather of quantum field physics, maintained that consciousness was primary. Matter was a derivative of consciousness. In the body, in the whole of nature, things on the surface are very dynamic, they're very complex, they're very diversified. But as we go down to more microscopic levels, we find things become more simplified, more unified, more silent. And at the base of it all is the self, is consciousness. And consciousness, Maharishi points out, Maharishi is the man who introduced the art of transcending. He pointed out that in consciousness is a flat state of being, a flat state of a field, if you like. But when in that process of being conscious, then there's threefold structure comes into being. It's just a concept, but it's the nature of consciousness. There's some aspect of consciousness that is knowing, that is the observer. There's some aspect that's being observed, that's a known, and then there's a process of interaction between the two. So these in Vedic terms are known as Rishi, Devata and Chandas. The knower, the known, and the process of interaction between the two. And this threefold structure is reflected on all levels of manifestation. There's a sequence of manifestation from the self, through ego, emotion, intellect, mind, senses, body, and the whole environment. So there's a threefold division that we can find on all levels. In Ayurveda, they're known as Vata, Pitta, and Kapha. Is everyone familiar with those terms? So Vata relates more to the Rishi, to the knower. It governs all movement of mind and all movement of matter and energy. Pitta relates to the process. It's the process of transformation. It's what generates energy. Breaks down whatever comes into the system and makes available energy. Kapha is to do with the known. It's more objective. And that's to do with structure. It's to do with building up tissues, fluid balance. So in Ayurveda, we focus on getting the balance right. So prevention is all about ensuring that these three are working together. Maharishi gives the example of the children. The three children play well together if mum's at home. If mum's not at home, then they start to play up and fight and so on. So mum's at home means that we're fully conscious, we're established in ourselves. When we lose that contact, we lose connection with ourselves, then the children start to play up. This process in Ayurveda is called pragyaparad, the mistaken intellect, where we forget who we are and become identified with a particular situation. Maybe it's tax time, and we're totally focused on trying to save our money from the tax man, and we forget to eat at the right time. We forget to go to sleep, and we start to get into habits that start to get imprinted in our physiology, and as a result, impurities build up. Or it may be that there was some problem with our relationship. We started to become depressed. Or we became too intent on one thing. We just got so involved in that particular thing that nothing else mattered. So these are three different types of modes that we can get into when we lose ourselves. One, we become excessively worried. That's the Vata mode. One, we become too intent, too obsessive. That's the Pitta mode. The other is we become cut off. We become withdrawn from the world. That's the Kapha mode, the depression. So it starts at that level, and then it's reflected on different levels of our physiology. So a Vata imbalance would be if there's irregularity in the motion of our bowel, for example, our breathing, arrhythmias, central nervous system problems. They're all vata problems. Pitta problems are if there's too much acidity, too much pitta or heat in the liver or the eyes, the skin. Kapha problems are related to heaviness, too much of that, the heavier elements, so obesity, diabetes, cholesterol, mucus problems. So the disease starts to manifest from the level of disconnection from the self, emotion, mind, and body. And there are 6 stages of disease identified in Ayurveda. In modern medicine, we identify the last 3 from the point of that the disease starts to manifest. In Ayurveda, we identify these doshas, this vata, pitta and kapha, in its earliest stages of accumulation and aggravation and spread. So this is the ideal of prevention. If we can identify and pick up imbalance at an early stage, and this we do primarily through the pulse. The pulse is a wonderful tool that I recommend all physicians to master, and it doesn't take long, but that way you get to know your patient from the inside out. And the patient also feels it too, that you connect with them on a very deep level. And it can be actually used as a healing art in itself. So by assessing a patient in this way, we're able to see where they're at in that spectrum from disease manifestation. And then we're able to utilise or advise them on the correct diet or how they should be looking after their mind, or how they should be looking after their lifestyle. The very simple changes can be all that's necessary at that early stage. Once it's developed to the point it's a very gross imbalance, a cancer or an autoimmune disease or whatever, and it takes a lot more effort from the doctor and the patient to get on top of it. So it's much wiser for the doctor to handle things at the early stages. And so I find in my medical practice there's no conflict in doing both. And patients are always coming in. They generally don't come because they're well. They usually have some motivation, and the guys usually have their wife to bring them in because they're reluctant to admit there's anything wrong with them. But generally we can always find when they come with some particular complaint that there's something we can also offer from a more holistic point of view to help them to prevent that problem coming up in the first place. And not just that problem, but many other problems. And that's the beauty of working at this more fundamental level of the physiology. Just a few manipulations there, and then everything else falls into place. Even problems that the person didn't even tell you about, they come back and say that my skin problem's cleared up now, or my bladder problem's cleared up. Just by operating at that level. And this is what holistic medicine's all about. Working at that level, at that interface. This is before the genetic level, as Craig was pointing out. We're working at that interface between mind, body and spirit. And if we can get the balance right there, then that's the essence of prevention. That's the essence of health promotion. That's how we make a patient well, by connecting them at that level, connecting them to themselves. And when mum's at home, then everything else is balanced.
Tim, I'd like to come back to you in a second on prevention and Ayurveda, specifically in relation to digestion, and 4 or 5 practical tips that people can take away today, simple changes that they can make in their lives on a prevention and health promotion side. But I'd like to move on to Lee, and Lee's going to talk to us about yoga and the yogic approach to preventative medicine.
Thank you, Ranjit. And particularly thank you to Craig and Tim, who've just done half my work for me. It's great being the third presenter because I can say yes, all of that. Yoga and Ayurveda, for example, are like 2 sides of the one coin. You can choose to look at one side, but the other side is always there. and they both derive from at least 3 of the 6 ancient darshans, or philosophical systems of the Indian culture, of yoga, samkhya and tantra. And so, as Tim was saying, really what we are is this field of consciousness, and through various principles or models we come to this manifestation made up of these 5 elements, and the mind is part of that manifestation. But for yoga to look at prevention, and when I say yoga, I'm not just talking about yoga asana. Yoga asana is one small part of yoga. According to Patanjali, the great sage about 2,000 years ago, it's less than 1/8. It's 3 sutras out of 195 sutras. In the West, we seem to focus on it a lot. Most yoga, up until around 1200, 1400 AD, was strongly based upon meditation, lifestyle. The physical side of yoga really came in as part of this tantric field, of which Hatha Yoga, the postural yoga we're so familiar with, is a subset. And underlying all yoga practice was, in order for us to find well-being, to prevent illness, we need, in fact, to dive deeply into the well of our being, which I think well-being is a great word to describe what yoga is about. It helps us to reconnect with that deep well of our being, which is always there. We don't have to make something. We simply just remove that which is in the way, exactly the same way as Ayurveda does. But it's often said that Ayurveda in traditional culture is very much like the medical system, and yoga is like the lifestyle, the psychology. In fact, I would suggest that yoga was probably the first codified psychology in the world. If we read carefully Patanjali's Darshana, the Yoga Sutras, it's very clear this is about psychology. Yoga is about the mind, as Craig was saying. If the mind is not right, all else goes astray. Now, when people practice yoga in the West, there is a great confusion. We use the word Hatha Yoga, and yet we're at the same time using the word Raj Yoga. They can blend together very nicely, like oil and vinegar, and make a lovely dressing. But essentially they are different, and we need to understand that. So that Hatha Yoga, the word Hatha means with force, is a very strong therapeutic practice. It talks about removing Vata, Pitta, Kapha, removing the wind, the bile and the phlegm. Very strong practices. And yet most yoga teachers will talk about having good health and preventing illness through the practice of what we often call Patanjali's yoga or Raja Yoga, where we have this wonderful blend of the postures, the pranayama, the breath work, the meditation, and the lifestyle injunctions, which is the yama and niyama. Okay, the things we really should be doing and things we shouldn't be doing for ourselves, for the world. And when we understand that yoga is actually a blend of all those elements of the Raj Yoga, taking some of the aspects of Hatha Yoga that actually fit with the yoga that seems to work for us in our society, which is the Raj Yoga, the contemplative yoga. We seem to have the yoga that we practice in the West for those who have gone deep enough and have practiced long enough. And so the key to prevention in the practice of yoga, according to Patanjali, in his Sutra 114, I've got a couple of my students in the room now, will be saying, here he goes, 114 again, is the practice needs to be over a long period of time, consistent, regular practice. So yoga as a preventative tool is not something, something's out of balance, my vata is a little deranged, I'm feeling the accumulation, the aggravation, it's going to spread from the colon into the bones, and this is sort of the Ayurvedic approach, really useful to pick up these things at accumulation stage, as Tim is saying. But in yoga, we say, just do the practice. Every day, let's do our sadhana, our regular daily practice. And for some people, that will be a little asana, hopefully some pranayama, almost always some meditation. And the asana can be the meditation. So we don't have to separate the two. Yoga doesn't separate body and mind. This is I would say it's the ultimate mind-body well-being practice, because it just does not see the difference between body and mind. Mind, as we know, is the non-local mind. I mean, every cell of the body is part of our mind. Psychoneuroimmunology is teaching us that. And so with yoga practice, we are bringing mind and body to the mat, inverted commas, every day. And because of that, our mind starts to turn inward a little bit. The time when we do our practice, whether it be 10 minutes of asana and 10 minutes of sitting quietly with our mantra or with something else, we remove our tendency to have an external locus of awareness, and we have an internal locus of awareness. An external locus of awareness, we're worried about what this person will think. We're worried about the money from that quarter or that quarter. All those things that are out there. The internal locus of awareness says, who am I? What am I? Why am I? And does that matter? So our daily practice brings us back to what Craig was talking about, the moment, the mindfulness, maybe people could even say mindlessness or mind quietness. And every single practice, every aspect of yoga sadhana needs to be mindful, otherwise it's not a yoga practice. And in our contemporary societies, we often see a physical practice of yoga. I've even seen pranayama techniques taught without any mindfulness. It's just huff and puff and count it. And we need to be sure that the mind is connecting with the practice. And when it does, as I said before, we turn inward a little bit. And because we're turning inward, our internal locus of awareness, we become aware of the things that Tim was talking about, those imbalances. We start to recognise them quickly. And over time, through regular practice and through not being attached to our practice, yoga teachers here know about Sutra 1.12, we need to have that regular practice and we need to let go and not hold on. So yoga at its core is teaching us this wonderful thing called vairagya, not to be confused with a certain medication that sounds similar. To let go, to disidentify from all the things that are causing us those stresses, to step back a little bit, to actually feel ourselves as the field, to be the spacious awareness that we really are, and to then observe that there is the lila, the play that we are playing out as part of our life, and to be able to disidentify from what it is in order to make better decisions, to help unwind the habits that are getting us into trouble. A small component of the preventative benefits of the yoga practice we have nowadays, which I'm sort of calling this quasi-combination, this oil and vinegar combination of Raj Yoga and Hatha Yoga, is that there are actually somatic benefits of what we do with the body. When we move the body in certain ways, this compression and release in certain organs can create blood flow in certain ways. By moving the body in certain directions and opening the body and creating spaciousness, we allow subtle energy to flow through our nadis and our shrotas. Yeah. So we are creating certainly a physical benefit. And you mentioned digestion a moment ago. I was interviewed at 4 o'clock this afternoon, just before I left home, by I think it's Good Health magazine. This is how the press acts nowadays. What is the single best posture for somebody to improve their digestion? And I'm going, oh no, not one of these questions again. Unfortunately, they'll print a posture, but because I went through all the thing of, it's not about the posture and a whole range of things. But yeah, every single unwellness can at least get some benefit from a yoga practice. And I'm saying unwellness as a distinction from illness, because there becomes a place where a regular practice of yoga and the role of the yoga teacher needs to hand over to the medical field, people more skilled and with greater knowledge in the complementary or naturopathic field, Ayurveda or other things, or to a yoga therapist who has further training. A yoga teacher in Australia, there's a registration process for yoga teachers in Australia. They need to have registration with Yoga Australia now to be recognised in a whole range of areas, both nationally and internationally, including health insurance. But in yoga therapy, the same thing is occurring. We now have a registration process, and we lead the world in the therapeutic application of yoga. I'm on an international committee in the United States, developing standards and implementing standards for yoga therapists right now, and they took our standards as a starting point. So we're doing good things. That was a little plug for how we're doing well in Australia with those things. So thank you.
So the common theme of the mind and consciousness, and Gautamji is going to take us a little bit deeper into that and explore that in relation to prevention and promoting health and wellness.
Hello, so I'm here to speak on prevention of illness with regards to Vedanta. Vedanta is the spiritual aspect of Hinduism, the deep philosophical part of it. Vedanta looks more at the mind, the subconscious aspects of the mind, and even beyond that, into what is called pure consciousness. From a medical point of view, then Vedanta can look at illness in two ways. One is that the body and its progression, transformation and modification, in which 6 modifications are posited in the form of change for the body. Asti, jayate, vartate, viparinamte, apakshiyate and vinashyati. These are Sanskrit terms. Conception, birth, growth, maturation, decay, and death. These 6 modifications of the body are considered to be inevitable. Of course, what we seek is to prolong a state of well-being and delay the onset of decay and death. With regards to these inevitable modifications, then Vedanta then looks at how can the mind face this inevitability. Looking at the function of the mind and its connection to the body, that pain of the body can be exacerbated through the mind's imbalance or inability to deal with the situation at hand. That leads to what's called suffering. So the pain of the body may not be optional, but suffering can be optional. Suffering is at the level of the mind. And so Vedanta focuses more on the management of the mind, strengthening the mind so it can hopefully prevent an early detection of illness, and also help to accept if there is a condition of illness. As such, Vedanta will have to be used in conjunction with other sciences. So now looking at the mind, mana eva manushyanam karanam bandha mokshayoho, it posits that the mind is the cause of our suffering. Suffering can come in the form of 3 ways. Many ways are there, but 3 large and obvious ways are given. One is called fear, bhayam. One is called confusion, moha. And the last one is called shoka, or regret. And when we look at how this relates to our life, when we look at our past, disturbance from the past is called regret. Disturbance with regards to the future is called bhayam, or fear. And disturbance with regards to the present situation is called moha, or confusion. These 3 disturbances affect the mind. Then the mind with these disturbances then has an influence because of its connection with the body. So it then leads to changes in the body as such. Changes in the body's well-being. Because the person also cannot be taken completely in isolation as their mind or their body. Vedanta also posits that many causes start from subtle regions and then express at a gross level. So the subtler regions will be the subconscious leading to the conscious mind and then manifesting at a physical level. So with regards to prevention, Vedanta focuses more on trying to address subconscious and conscious levels of the mind. How to deal with, as we said, these three: regret, confusion, and anxiety or fear. Fear, of course, has many different levels, from insecurity to anxiety to an abject terror because of a death or dangerous situation in front of a person. Vedanta then gives various techniques, but the key is to learn what is called self-diagnosis, what we may call Atma Parikshanam, examination of oneself, to start becoming more aware of the subtle changes that are taking place at the level of the conscious mind. So, what does precipitate my individual anxiety? What precipitates my individual confusion? And of course, what am I carrying in the form of guilt, in the form of regret? This becomes a very individualized and personalized discovery. And so, therefore, in Vedanta, the training is for the individual to come to reflect, analyze, and introspect upon themselves. The process can be broken down into three levels. And one is called detection, one is called negation, and the last one is called substitution. In detection, there has to be a very honest and open identification of what disturbances are taking place at the level of the conscious mind. For this to take place effectively, then qualities such as being able to distance or detach oneself from the mind become very important. As long as we are identified with the mind very strongly, there can be levels of denial. And through these levels of denial, then an inaccurate diagnosis then takes place. So Vedanta helps to create that distancing between oneself and the mind. So this distancing is called adopting what is called the witness attitude. So Sakshi Bhava. And in a witness attitude, I come to watch the flow of thoughts as they pass through my conscious mind without judgment. No matter how terrible, how disturbing those thoughts may be, I try to observe them as an independent witness and merely take note of them. As we become more proficient in this, early detection of mental disturbance can take place. We also come to notice habits or patterns of thinking, emoting. These patterns are created because of subconscious impressions. So as we come to watch the thoughts, we start looking for patterns. And these patterns give us identification of subconscious impressions, which have almost been laid out like the channels in which rivers are about to flow. As we come to identify this, we are now getting right to the very cause and root of mental disturbance, which later can manifest as physical illness. So Vedanta focuses on this aspect in terms of prevention. As I mentioned, once onset of an illness has taken place, then Vedanta and its role is then to prevent denial, which means to accept the situation at hand. And with greater acceptance, reduction in suffering takes place. Also, more effective treatment can take place through other modalities, because a person becomes, well, they accept the condition they have and then move forward into the treatment that is required. Many times people are diagnosed late because largely they are denying the fact that they are in a state of ill health. So many people don't want to see doctors because they know when I see the doctor, he's going to tell me my cholesterol is bad. He's going to tell me I need to start exercising. He's going to tell me I need to change my lifestyle, slow things down. Yeah? And this is because we are not willing to accept the situation at hand. Vedanta helps us to accept so we can get into more immediate and effective treatment regimes, which I said will have to be in conjunction with other forms of medicine and natural paths as well. So from this point, Vedanta is looking or can facilitate prevention at a deeper level of the subconscious and conscious mind.
So sometimes, despite all best efforts with exercise, diet, various things, we become unhealthy. And I'd now like to move into Craig and talk about ischemic heart disease, one of the most common conditions in the Western world that causes much suffering, and the role of meditation and mindfulness in patients with heart problems.
Well, the activation of the so-called stress response or fight-or-flight response is pretty good while we're trying to get away from a target. But activating this response at 3 o'clock in the morning with a mental target, anticipating this fear, this anticipation, the mind projecting into events that haven't even happened, or replaying stressors from the past, produces a very profound effect physiologically and metabolically that is an inappropriate activation of the response. It's not experienced as like a turbocharge of energy, it's experienced as anxiety. And mind you, although I'm talking about anxiety, same thing's happening in depression, anger and hostility. All of these unhelpful emotional states produce this overactivation of this activation system. From a heart point of view, well, the medical term for it is allostatic load. It puts a wear and tear on the system that it was not designed to take. And so it affects us metabolically, blood cholesterol, blood pressure, blood glucose and so on. It thickens the blood, increases the risk of the heart going into arrhythmias and so on. What we're doing is we're creating a physiological soup in our own system. It's going to predispose us to heart disease, and indeed it does. So consistently poor mental health, recurrent depression, for example, increases 3 to 5-fold the risk of getting ischemic heart disease, independent of exercise, cholesterol, or any other risk factor you care to measure. That's how profound the effect of the mind on the body is. You give a person antidepressants to treat their depression, you don't do anything to reduce their risk of heart disease. In fact, a lot of the early antidepressants increased even further the chance of getting heart problems. They didn't reverse it. You give psychological approaches to helping to switch off the unnecessary activation of that response, cultivate more positive emotional states, and you do significantly reduce the person's risk of having further events with their heart disease. So the research around meditation, it produces the opposite of the activation response, called the relaxation response. I think one of the tricks is not getting anxious about trying to relax. Has anybody here ever gotten anxious or very tense trying to relax? That doesn't help very much. So actually learning to feel comfortable, even in the presence of distress, this witnessing attitude, I think, is really important in that regard. It's a very important part of not accentuating it. What is also, and I'd just like to mention briefly, is very interesting, is that the only kinds of programs that have ever been, or treatment that's ever been shown to reverse already significant or advanced ischemic heart disease has actually been based on yoga principles and the work of Professor Dean Ornish from the States, who took up a lot of these things when he was a young man to help him as a stressed medical student, and made a profound difference to his health. But when he became a cardiologist, he said, I'll take these principles and I'll turn them into a rehabilitation program for people with heart disease. And it was based on meditation, a supportive group environment. He said, if you don't get the mind right, don't get the motivation right, you can't make the other changes. But physical activity, a low-fat vegetarian diet, stopping smoking and so on. So very simple things. But what he actually demonstrated angiographically, symptomatically, was people who had heart disease, who took on that program, their body started to do its own angioplasty. It demonstrated clearly, and he published in the Lancet and the Journal of the American Medical Association, this was absolutely gold standard research, that the body will repair itself if we give it the right conditions to do that. Exactly what Tim was saying before about the movement towards balance and health is a natural one. It's more a matter of getting out of the way of that happening. And so it's actually meditation, if you like, as a foundation for a much more holistic lifestyle integrated approach. Those same principles, if you don't mind me mentioning cancer, for people with men with early prostate cancer, has also shown reversal of all the cancer markers for men with early prostate cancer if they took on the same principles. switching off the prostate cancer genes, switching on repair enzymes right in the DNA of the cells, and very unlikely that early prostate cancer would go on to become an aggressive or life-threatening prostate cancer. And so these kinds of principles are actually based on the lifestyle elements that were inherent in the yoga and Indian tradition, but just given a different language and given a different context and given a different way of studying it. The same principles too have just been applied to multiple sclerosis. Again, it's assumed you can't reverse multiple sclerosis, but quite independently, Professor George Jelinek, who's just based at St Vincent's Hospital just down the road here, who got MS himself as a professor of emergency medicine, said there's nothing that modern medicine can do. He looked at all the research, and the program he came to for MS is remarkably similar to the conclusions Ornish came to. He's actually demonstrating now reversal of MS for people who've even had that condition for a number of years. So people are on an upward trend in terms of improvement. Brain scans are improving and so on, which was not thought to be medically possible. And this is just being way underutilised in healthcare. And the ridiculous thing is that the data on this shows you don't only get better outcomes, you get better quality of life, people feel better than they have for many years, but also the cost savings are amazing. Because people don't go on to have all of the aggressive treatments otherwise would have had if they'd just done treatment as usual. Now, it wasn't a neglecting of, appropriate monitoring and everything else. It wasn't a rejection of conventional medicine. It was just saying, all right, well, you do the monitoring and the managing all of that, but do this as well, you get disease reversal, only with high level of adherence. So massive cost savings, but the industry is not geared towards saving money. The healthcare system is, and various elements of it, which I won't go into, geared around increasing healthcare costs, and which is a real shame because these aren't patentable products. So there's not the economic drivers to promote them in the same way as there is various patentable products. But
so just in practical terms, Tim, a patient who comes into your general practice with, he's had a coronary event, he's had an angiogram, or she's had an angiogram with a coronary stent placed, has gone on to a statin, aspirin, and other medications. How do you go about in Ayurvedic terms, though the Ayurvedic approach is different for each patient, in broad principles, how do you go about integrating Ayurvedic medicine with what the patient has already been started on with conventional medicine? And can the two coexist happily?
Yes, there's no problem in Ayurveda coexisting with modern medicine. In fact, I see that modern medicine is a part of Ayurveda rather than the other way around. Ayurveda actually forms a framework for integrating all pathies into one complete science. So it's all there. And if I have such a patient with coronary artery disease, then I'd do it the usual way, but always have my hand on the pulse first to get to know who I'm dealing with, who is this patient, and where his particular imbalance, what mode it's taken, whether it's in the Vata mode, the Pitta or the Kapha mode. And first I would advise a mental bath morning and evening to transcend all thought and concerns of the day and just be. And as Craig pointed out, there's some very good research now that this can turn around heart disease. It's very interesting that the mind, the heart seems to be very susceptible to meditation, to the mind quietening, more than any other organ. There's this very close connection between the heart and the mind. And the studies that have come out through the Maharishi University of Management and National Institutes of Health, which have funded a number of these studies, have shown that people with coronary artery disease who practice transcendental meditation have 47% reduction in deaths, heart attacks and strokes when followed over a 5-year period. So this is without any change in diet or lifestyle, just with meditation. 48% reduction in heart attacks, strokes and deaths. When you consider a statin can can give about a 30% reduction. That's pretty good. And this is on top of the statins. They're already taking their statins and antihypertensives. So the mind is very powerful, and I think it points to, the problem in our Western world is that we are very disconnected from ourselves, from our emotions, and the importance of reconnecting. So number one would be the mental bath twice a day, and then generally with people with chronic disease, there's a lot of AMA. AMA means undigested, unmetabolized waste. The body hasn't completely processed, digested and metabolized, and this is like a sludge that gets into the tissues, interferes with the cells functioning, and is at the basis of most health problems. It's what further disconnects us from ourself. So they need to do some cleansing. They need to go on a light diet. They need to take spices and herbs that help the process of cleansing. And there's a very elaborate system of cleansing known as panchakarma in Ayurveda, where you go to a hospital or a residential facility and go through a sequence of processes: massage, internal cleansing, very, very pleasant oil therapies, and herbal therapies to bring about this removal of these toxins. And after that, then we can be more effective in our diet and everything else. Just a couple of points about diet. Digestion, as I pointed to, is very important. It's not just what we eat, it's how we process the food. And how we process the food very much depends on what's happening here. Are we connected with what our body's telling us? Are we hungry at the time? If we're not hungry, then we don't eat. It's very simple. And we should just eat to the point we're comfortable. If we overdo it, then we create AMA. Very important that all senses are satisfied when we eat. So that the senses are involved in preparing the body for the digestive process. So the meal time should be settled. We should be eating in such a way that our body is ready for the food. It's hungry. It's not still digesting the donut we have for breakfast or whatever. So make sure we digest the food well. We're in the right state of mind. We're tuned into what our body's telling us. And in terms of the types of foods we should be eating, if we're more Vata type, then cholesterol-lowering diet is actually counterproductive. It's going to make your Vata worse. It's going to make you more anxious. It's going to create more blood pressure. So it's important that we know who we're dealing with. A Vata type needs to have the omega-3s. They need to have some saturated fat and monounsaturated fats in their diet. A Kapha person, sure, we focus on cholesterol lowering. And we'd also focus on exercise for Kapha. Kapha tends to be more sedentary, tend to put on weight. So they need to be motivated to do more vigorous exercise. Pitta types are more prone to inflammation, another aspect of coronary artery disease. So if Pitta is strong, then they need to be careful with too much salt, too much alcohol, hot spices, that sort of thing. So the diet needs to be tailored according to the individual. And then the same with the lifestyle. So a Vata type, we wouldn't recommend doing marathon runs or going to the gym and doing heavy weights. Some yoga or walking, swimming, that type of thing, that's not going to push the body too much for the Vata is important. Kapha types, as I mentioned, need to be more vigorous in their lifestyle and their exercise. So then after that we'd look at the herbs. So the herbs are not the be-all and end-all, but if we prepare the mind and body, make sure that the body is clear of this toxicity, where the body is being fed the nourishing foods that are going to restore the memory of balance. Food should be organic, should be free of toxins, not genetically modified, should be prepared fresh. All these are very important to ensure that full intelligence is there in the food. The synergy of all the active principles is there to wake up the body's intelligence. So very, very easily we can help prevent these problems from recurring.
Now we can continue talking for a long time, but I'd like to open it up to question time. So I think I've got one here at the front.
Yeah. Tim. This question. Hi, Tim. This question's to you. Do people's types change from over time? So if someone's Pitta or Vata, do they change? Does their constitution change?
Yes, that's a good question. So we're all born with a certain type. It's determined by what our mother was doing when we were in the womb, what food she was eating, by the constellation at the time of birth. So all these things together, and our genes have some part to play in it. So it all comes together in determining whether we're Vata, Pitta, or Kapha, or some combination. Usually we're a combination of 2 or 3. And then if we're brought up in a certain environment and fed a certain diet, then that can also have an influence on our doshic makeup. So that becomes a different type of body type. It's called the Daya body type, Daya Prakriti. And then if we're getting into imbalanced ways, we're becoming stressed and becoming anxious, or too depressed or too intense on things, and that will also have an effect on our doshic makeup. In fact, that's the most important one to know. So through the pulse, we're able to primarily pick up what's happening now, we call it Vikriti, what the current imbalance is, and that's determined by what foods and things we're doing with ourselves at that time, as well as what's happening in the mind. So the most important thing is to know where we're at now, and then on that basis we can then identify the foods, activities, and cognitive approaches we need to bring it into balance.
A question behind you, Prag.
It is very interesting to see, the observations from the experts in different fields. Thank you very much for that. But being a cultural Indian, there is no interesting things unless you are provocative. See, in India, they don't do yoga. They don't read Vedanta. They don't analyze their health. They live their life as it comes and then take it as a fate. And how do they manage? See, what I am trying to think is, it all has to be in the culture, not in the teaching or individual doing. What do you think of that?
Thank you for the question. I'm going to hand it over to Gautam in a moment because he's obviously far more credential than I have, you can clearly see. But what I have noticed in many, many, many trips to India and discussing with leading lights such as Dr. Ananda, Shelley Tellis, and well-known people who study this, we've got to be careful not to make an assumption that the Indian culture is all one culture. India is blessed with one of the highest increasing rates of diabetes and heart disease in the world. So it's not actually getting very good scores for the people who are not practicing these things we're talking about. There is a re-emergence, albeit a slow one, of the ancient traditions coming back in India. That's my take on it, but we'll see what happens.
Your fundamental question is then, why is it in India that it appears to be greater health? Is that it?
No, I don't mean that. What I am trying to say is, they take it as it comes. They are not anxious, they are not fearful, they are not, in a way, trying to fix the problem.
It's a large generalized statement. I don't know if I can substantiate that, to be honest. I don't know if I can necessarily substantiate that comment. Of course, culture and lifestyle are connected. I think one thing is that our individual lifestyle, to maintain an individual lifestyle, it is much easier when the people around us are also following that. So when people around us also follow a common behavioral pattern, then we can call that a culture, so to speak. Yeah, a person may have an individual lifestyle, but it becomes more difficult to implement and execute healthy living techniques if the people around you are very unhealthy. So certainly in an area where everyone is following a healthier lifestyle, or you have a healthier culture, then it becomes easier for the individual to also follow that. Now, whether that's happening in India or not, I can't necessarily, like I said, substantiate that, because I think the research is showing that there is a lot of ill health there as well. So that's about all I can say. I think the statement is possibly too general.
Additionally, we can either take it as it comes, or we can prevent it before it comes. So I think we're looking at implementing these kinds of sciences to prevent it before it comes. And if it happens, then we take it as it comes and take the necessary action. Question?
First of all, thank you to the panelists. It's been a good evening. I have a question. We've got 4 different areas we've discussed, but how would the term the self be defined in the different areas? Because I know some people say, okay, mindfulness is the self. Some people have studied Samkhya, they say the consciousness is the self, or the observer, or the witness, or the Sakshi. Many different terms. Could we have a view from the different areas? If you're digging down deeper,
yes,
what is it that knows that it knows? That's my question.
It's a very deep question. I think the urologist is not the person qualified to answer that question. So I'm going to go straight to Gautamji.
So the self in Vedanta is called Atma. And this Atma in its essential property, essential nature I should say, not property, is considered to be Sat, Chit, Ananda, having 3 nature. Swarupa is the word in Sanskrit, but it means we can say essential nature, that from which it does not deviate. So one is Sat, pure existence, Chit is pure consciousness, and Ananda is pure bliss. Sat refers to the undeviated awareness or notion that I am. I am. At no point in time does a person ever feel I am not. A person can only recognize that I am. So that sort of brings out the Sat aspect of it. Chit is the aspect I know I am. I am aware. I have self-awareness. I am aware of my own existence. We would say that a table, a chair, does not have this Chit or Chaitanya aspect of self-awareness. I'm sure if the chair knew it was aware, it would try to avoid me sitting on it. So it would just run. Yeah? So, self-awareness is called Chaitanya or Chit. And the last one is Ananda. Ananda is a state of deep, fulfilling peace which transcends even the mind. Of course, now that seems to be largely obscured by our mental, conscious and subconscious processes, which seem to be almost blankets on top of actually the essential nature, which is Ananda. And that's why through the processes of meditation, quietening the mind, what we are trying to do is actually remove that blanket of the conscious thought processes to discover the self as it is. And that's why one does feel greater peace when one can slow down the mental processes. So from a Vedantic point of view, the self is considered to be Sat, Chit, Ananda, and it is different from all other aspects of body, mind and intellect. That's how Vedanta would look at it. I'm going to handle it over.
This, of course, is a very deep topic, which is beyond the scope of a 1.5-hour seminar, and is probably more the scope of a lifetime and many lifetimes. So I'm going to keep going with more questions. We've got another 10 minutes to go.
Thank you for such wonderful information and contribution. My question is about mental health issues which are a little bit above depression and anxiety. Of course, there are different extremes within those experiences, but things like schizophrenia, personality disorders and things like that, which although that they will respond to lifestyle changes and things, that there seems to be I'm not quite sure what the right terminology would be, but there's an element which is perhaps more stubborn, for want of a better word, doesn't respond so well to things like counselling or meditation and lifestyle changes and things like that. I'd be very interested in anyone's input.
I'll just briefly start that and say that a prudent yoga teacher and yoga therapist who is sticking by their code of professional practice will always work in conjunction with a multidisciplinary team if they are to be involved with somebody with what you're calling a high level mental illness, and that little steps, rather than trying to... We're not looking for revolution, we're looking for evolution sometimes with the yoga practice. So that's how we would approach that.
From a meditation perspective, if somebody had a disposition towards psychosis, and that could include schizophrenia or bipolar disorder, for example, that would be a relative contraindication, or at least a caution for meditation practice, especially intensive meditation practice. A 10-day silent retreat, just you and your mind on the cushion, may not be a really good idea. There are isolated examples of triggering psychotic episodes with intensive practice for somebody who's not both experienced and appropriate for that. For a person in an acute psychotic episode, meditation, again, sitting contemplative practice like that, may not be a good idea either. But activity that engages the attention, that brings the person to the present moment, something that's moving or more active, that engages the attention and unhooks the attention from a very chaotic state of mind, could be a very useful thing to do. There is some research on, say, things like mindfulness for a person who's had a past history of psychosis in a stable phase of the condition, not doing intensive practice but learning to live with more attention and awareness and presence, who has enough insight to be able to start to stand back from the thoughts and to start to not get so drawn into them. That the research tends to show that it doesn't make the condition go away. It improves the resilience and ability to manage stress, which is sometimes a trigger for new episodes. But secondly, it helps to reduce the intrusiveness of residual symptoms. And did you see the movie A Beautiful Mind? Yeah. Now, I think that's actually what he was intuitively practicing, that the residual symptoms were still there. It wasn't like, going away, but they were intruding less and less upon him and his ability to function. And I think that meditation can be used in a discerning way with a very well-trained mental health professional who's very experienced in meditation, can cautiously, with the appropriate motivated person, use that as an adjunctive treatment, and moving just cautiously in conjunction with medications that may be appropriate for that particular condition as well. So very much a joint approach, I think, is needed. But it is an area for caution with meditation. Proceed with caution.
So time for one last question.
Thank you very much. It was a really interesting talk. I just wanted to know whether there was any research on the role of these treatments in dementia. And we're hearing a lot in the news about early Alzheimer's, early dementia. It's a big problem in the Western world. And I just wondered whether there was integrative therapies that were research-based.
Maybe I can just start by saying we're very keen to get research going. I've been trying for the last 2 years to try to get some research in Australia, but you need, in order to do so, to get the funding, you need to have a pilot study, but the pilot study needs funding also. So we're in a bit of a catch-22 situation. So if anyone has any ideas on how we can get research going here, I'd be very interested to hear, because I'm sure, particularly with meditation, that we can do a lot to prevent cognitive decline that happens in some of us. As I mentioned, health is a natural phenomenon. To dement isn't what we're born to be here for. There's something obviously fundamentally wrong that we're doing with our lives, or that we're being exposed to in our environment, that's causing this epidemic. So I'm sure the whole approach of Ayurveda, meditation, has a lot to offer. There's already some research on the Ayurvedic herbs, particularly Withania somnifera, which is actually shown to to enhance neurogenesis. We've heard from Craig about how meditation can actually help the brain to develop, synapses to form. With transcendental meditation, the research shows that the whole brain starts to become more connected. The prefrontal cortex here, which is what makes us human, what enables us to think and be able to see consequences of our actions, starts to come online. The alpha rhythm here is seen throughout the whole brain. The neural imaging shows that the cortex starts to light up throughout the whole brain. So something's happening there that's contrary, quite the opposite to what happens in people with dementia. There's this build-up of rubbish in the cell, these plaques. It's all just rubbish that the body hasn't been able to deal with. So proper detoxification, purification, I'm sure, will do a lot to prevent these sorts of problems.
From the risk factors for dementia are the same as the risk factors for heart disease, for cancer, for all the chronic illnesses, which means that the treatment for it is the same as well. If you want to look at a total approach, the Ornish approach, because omega-3s, plant-based diet, low saturated fat, all of these things have been shown to reduce the risk of dementia. From a mind, body and meditation perspective, there's very good research to show that if there's something called default mode. Default mode's the distracted state of mind. When we're not paying attention, we go into default mode, worrying, negative self-talk, reliving past things, So default mode's the mode of mind when we're distracted. And research shows the more time a person spends in default mode, the more the brain gets gummed up with amyloid and all of the proteins that predispose to dementia. The less cognitively stimulating things a person has in their life, things that engage attention and interaction, the more likely a person is to get to dementia. The research shows that when a person practices paying attention and being present, so as in meditation, it stimulates new neuronal growth in the hippocampus, which is the memory centre of the brain, the prefrontal cortex. It literally thickens up the grey matter the longer a person's been practicing. Now that's circumstantial evidence to show that it actually reverses the assumed thinning of the grey matter that happens with ageing. Now there are a number of trials that have already shown that if a person learns meditation with early cognitive decline, they improve their cognitive functioning. And another recent trial showed as well with yoga practices, again, improve cognitive functioning, improve memory. We are actually doing a trial at the moment on mindfulness for people with early cognitive decline. So there is a trial that's in the early stages at the moment. So yes, there is an evidence base and the signposts are pointing in a very positive direction. I can point you at some of those references if you're interested.
Thank you very much, Craig. Well, time has slipped away. Would like to thank everyone for joining us at the Australia India Institute. I'd like to thank Professor Mathu, who unfortunately is in India. He got caught up in the floods in Kashmir, but thankfully he is safe. Thank the Institute for putting on tonight's function. Would like to thank all the panellists, Craig, Tim, Lee and Gauthamji. And we look forward to talking more about integration. I think the common theme that has emerged this evening is the mind and the consciousness is so important in terms of prevention and in patients with the disease. So we all need to meditate. Thank you.